Right. So, Cheyenne, we, in part of our review of the surveillance, we look at wastewater, we look at cases, we look at hospitalizations. We've been reporting hospitalizations, we look at deaths, and of course, those decisions are made at the local level. But at this time, we continue to recommend masking in areas of high and substantial transmission. That's much of the country right now in public indoor settings. And so we're, of course, taking a close look at this in real time, and we're evaluating rates of transmission as well as rates of severe outcomes as we look at updating and reviewing our guidance.
Next question, please.
Victoria Knight at Kaiser Health News.
Thanks so much for taking my question. So I've been talking to people who are immunocompromised, people who are disabled, living with chronic illnesses, and they're all telling me that they're feeling like they are being left behind, especially in light of a lot of states lifting their mask mandates, and they're feeling like their needs are not being considered moving forward after Omicron. So what is your message to them? What do you expect them to do? Do they need to just stay in their houses? What is your message to people like that?
Dr. Walensky.
Right. So this is among the considerations that we take into account as we work on all of our recommendations. We, of course, have to make recommendations that are, relevant for New York City and rural Montana. We have to make recommendations that are relevant for public, but also for the public who is immunocompromised and disabled. And so all of those considerations are taken into account as we work on our guidance.
Please.
Go to Caitlin Collins at CNN.
Thanks so much. Dr. Walensky, you just said that you do continue to recommend masking indoors in areas of high transmission, and that you said that that's most of the country right now. So are you seeing any data that supports the decisions of these governors to drop mandates? And when it comes to masking, should people be listening to the CDC or listening to their governors?
Caitlin, we've always said that these decisions are going to have to be made at the local level, and that policies at the local level will look at local cases, they'll look at how local hospitals are doing, they'll look at local vaccination rates. And they, as I understand it, in many of these decisions are using a phased approach. Not all of these decisions are being made to stop things tomorrow, but they're looking at a phased approach. And so what I would say is, again, they have to be done at the local level, but I'm really encouraged that cases are continuing to drop dramatically. Hospitalizations are continuing to drop dramatically as people are making these decisions and as we are working on our guidance. So I'm encouraged to see those trends.
Next question, please.
Go to Cheryl Stolberg at the New York Times.
Cheryl.
Can you hear me?
Now we can, yes.
Sorry about that. Thank you for taking this question. It's for Dr. Walensky. Dr. Walensky, the states have been asking explicitly, governors have been asking explicitly for guidance from the CDC on mask wearing and how to relax mitigation measures. Is the CDC prepared to provide guidance to the governors, and when will it do so?
Cheryl, thank you. And I'll simply go back to, yes, we are prepared. We are working on that guidance. We are working on, following the trends for the moment. What I will say, though, is, our hospitalizations are still high. Our death rates are still high. So as we work towards that and as we are encouraged by the current trends, we are not there yet.
If you enjoyed this video, hit like and subscribe to our channel so you'll be sure to see similar videos from BlazeTV with the added bonus of signaling YouTube that your voice and opinion still matters. And if you're looking for more great conservative content, check out one of the 2 videos suggested here.